Well, welcome back. And an important topic for many of you, Women's Heart Health Month. Even if you are not a woman, there's probably a woman in your life, so this is definitely an important topic for a lot of folks. We have Dr. Linda Calhoun here with Cape Fear Heart Associates and also the New Hanover Regional Medical Center Physician Group. So thanks for coming in.
Good morning,
I appreciate it. This is such an important topic, and some information that released recently by the Heart Association. And I know we've been talking about this for years. Women are still unaware of heart disease being a big problem for women and how to detect it. So what is the one thing that you tell women today about heart disease and their risk?
Well, I think, one of the things we have to kind of keep perspective is that you can't prevent something if you don't know you're at risk.
Exactly.
And what's really interesting is, you think over the years, because we keep pounding on this every couple of years, that women would realize their risk for heart disease. But a survey released in November at the American Heart Association actually showed that only 45% of women were aware that cardiovascular disease was a leading cause of death in women over cancer. And of those, most of the women were less educated, non-white, younger. And I think it's because women aren't thinking about prevention until they're later in life.
They're normally, taking care of other people is what I've kind of always been told. But what should you do now? Let's say if you are in, maybe your 30s, your 40s, even your 20s. What is it women need to be doing? Do they need to be looking for something particular, exercising
I think
more?
What's really interesting is all the problems that lead to coronary vascular disease, a lot of them are silent, like high blood pressure, high cholesterol, diabetes, or prediabetes. And these are things that can only be screened for by physicians. What's kind of concerning, too, is that only 39% of primary care providers are actually talking about cardiovascular disease and cardiovascular disease risk factors with their patients. So we want to encourage both doctors to, to get involved with their patients and talk about cardiovascular disease and their risk factors, as well as women being aware of what their risk factors are.
Right, and if you aren't aware, you really don't even know, just ask your doctor, what is it that I need to be worried about? All right, great information, Dr. Calhoun. I appreciate you coming in this morning. Bob?